Hi and welcome. My name's Harvey Olivia and we're going to do our competency checklist review for non-invasive positive pressure ventilation. So like anything else, when we start, we want to verify our physician's orders, make sure that we have an order for this. Go ahead and look at the chart, make sure you scan the patient charts. I'm going to wash my hands, I'm going to put on my PPE. Any types of masks or gowns I would need before I go in the patient's room, I would make sure I put that on. So we're going to assess the patient. Hi, Mr. Dexter. My name's Harvey. I'm with Respiratory. The doctor ordered what's called a BiPAP machine. Have you ever had a BiPAP machine before or used one? Sometimes patients do. Sometimes patients have one at home. So just always ask, make sure that they're going to understand what you're going to do with them and what you're going to put on. So I'm going to put a mask on you. It's going to help you breathe. So it's going to feel kind of like you're driving down the freeway at 75 miles an hour and you've got your head out the window. It does feel like a lot of air blowing you at first, but most of our patients are going to have to just get used to it. Once they get used to it, they find that it does help a lot. So you're going to also check the vitals. So we want to check respiratory rate, heart rate, we want to check the SpO2, we want to get a blood gas and see if we need what type of settings we might need to start on, kind of like a GPS for us. We want to check RISP, the Rapid Shallow Breathing Index. We want to check vital capacity. We want to check tidal volume and also minute volume. You may need to get a right spirometer for that to check those things, just to let you know. Once the patient's on the BiPAP, we do have the ability to check most of those things with the BiPAP machine. Once you have checked everything, explained everything to the patient, you're going to get your equipment together. I've already have this V60 in here. I'm going to go ahead and show you the parts you're going to need. So you're going to need a bacterial filter. I'm going to go ahead and place this on here. Okay. You're going to need some type of vent circuit. Some of them are made for different types of machines, so you might have extra parts you don't need and you may throw those away. And then this one has a little adapter to fix the proximal pressure line, and this is a single circuit lumen, a single lumen circuit. So you have to have a mask that has an exhalation port on it, and you always want to use the Philips mask that's made for the machine if you can. You can use different masks, but it's recommended to use Philips. This has an exhalation part on it. And then finally, the other piece that I have is a little holder for the circuit. So I'm going to go ahead and assemble this so that you can see how to assemble it. This goes into here. This part goes into here. This part is going to go into your mask, okay? And I don't recommend to undo the straps once it's on the patient. We have what's called a quick release. And what this is for is this in the event that the patient feels nauseous or feels like they might need to take the mask off for whatever reason, they can quickly take the quick release off, and then this lifts up so they don't have to readjust the straps every time. Okay, there's also a 1 on here. The 1 number is what you're going to have to input in the machine once we get started, so that it tells the machine the proper adjustments it needs to make based off of this mask. So I'm going to put this over here, get our circuit going, and then I'm going to turn the machine on and show you, and then we are going to put it on the patient. So I'm going to go ahead and turn the machine on. So it's starting off in what's called the ST mode. That is also the BiPAP mode. So you have an IPAP and EPAP. Rate, here's your FiO2, and then you have your I time. Now this machine will do other modes. You have CPAP and you have AVAPs. This is just the one that we're going to start off with, just to show you for simulation purposes. Now it does mention here a little I. You do see where it says the mask, so we will tell it the menu. So this is your brightness, loudness, mask port is what you want to select, and I've already selected the 1 from the previous time I set it up. Here is also your position port. You're going to say accept, and then we're going to go back to our ST settings. So your settings will be here. If this was on a real patient, you will be seeing settings at the top that reflect what the patient's doing. Right now this is just in my hand. Okay, so now that we have this ready to go, there are power buttons here. It does hook up to oxygen. So I'm going to go ahead, Mr. Dexter, I'm going to go ahead and put this on you. Okay. So make sure that your patient is aware of how to disconnect this in the event they need to take the mask off. Mr. Dexter, I'm going to go ahead and start with this on your head. I'm going to do it loosely so that it's not too tight for you, sir. Can you lean forward a little bit? Thank you. I appreciate that. So I am going to loosen it up, Mr. Dexter, just so I can get good fittings for you, and I will make the adjustments as we go along so that you're more comfortable. Okay? So that will go there. And then if you have to make adjustments and loosen it up, do it all now. And once you get it secured in the proper place and the patient is comfortable with it, and they do need to take it off, if they don't need to fully remove it, they'll just be able to take these quick releases off. One thing I want to mention is that if this is going to be on a patient for an extended period of time, you will want to get what's called a gel protector. We sell different variables at the hospital. There's ones that are big, there's ones that are small, but that is a gel type of material that goes on the bridge of the nose, and also some go on the sides of the face to protect the patient from shear friction and any kind of sores that may develop from having a mask on. Also, if the mask is too tight. Okay, so once the mask is secure, Mr. Dexter, does that feel okay? Is there any adjustments you'd like for me to make, sir, or anything? And if the patient's fine with that, then you're good with that. You may need to adjust it throughout the day a few times. You may need to see that he might benefit from a different type of mask or a different size mask. We do have nasal pillows. We have full face masks that we call fireman's masks that go over the entire face. We do have just ones that go over the nose. And then we have these ones that Dexter currently is on where it covers the nose and the mouth. So once you have your patient hooked up, you would monitor what they're doing. You would document everything as far as their rate, their tidal volume, the minute volume, your leak, and then you would also set your alarms. So alarm settings here, you would want to set them appropriate. So you do not want your patient to be breathing 60 times a minute before it alarms. So I have mine set at a rate of 30. Your tidal volume, you don't want them to have too big or too little, so you'll set it what you feel is appropriate for your patient, and also your pressures. If you needed to put this on standby, you can put it on standby, and you would hit standby, take it off the patient, and it will automatically go into this mode. Okay, then you're just going to start it back up. Okay, so as your patient is on the machine, you're just going to make sure that they're comfortable. You're going to make sure that you have the appropriate settings. You're going to make sure that the doctor ordered whatever settings you're going to put them on. So you'd want to follow your doctor's orders and make sure that everything that is for the settings is appropriate, and that's what the doctor ordered. So once your patient's on this machine, you're going to document throughout the day. You may need to make several adjustments. You will look at different parameters. You're going to check your alarms. You're going to check your vitals. You're going to make sure that if you're able to look at graphics, you can look at graphics for flow volume. Once you are done, you're going to clean up any mess you have. Ask Dexter if he'd like anything or anything he would need. Make sure his call light's within reach. The other thing I want to mention too before I get ready to wrap things up is a patient that is on a BiPAP cannot be restrained. So make sure that there are no restraints on the patient's hands in the event he needed to take it off because he had to vomit or felt nauseous. If he was restrained, he could not, and he would aspirate whatever vomitus that would go into the mask would go straight into his lungs. So you would never want to restrain your patient. So make sure you clean up your area, wash your hands. Thank you, Dexter. Have a good night, and thank you, everyone.